You're listening to Physio Natters, this month in association with Choose Health, and this is session 1. Welcome to Physio Natters. I am Jack March, and this is the reactive journalistic version of the longer Physio Matters podcast. At 20 minutes long, it will be an accessible form of CPD that allows clinicians to keep abreast of what is being discussed with impact upon clinical practice. Encourage engagement, discussion and interaction, it aims to take a swing at wide-reaching topics that need sorting out or discussing in the world of physiotherapy and healthcare. This month I've been slightly brave in that I'm not only handing over the question responsibilities to another physio, but to a student physio. We all know that as a breed they can be pesky know-it-alls, trying to steal the knowledge from our brains, while simultaneously telling us that we are out of date. No? Well, maybe it's just me then. Personally, I think students are a great opportunity to test out your reasoning and teaching skills. However, there has been mention of some disparity across social media about the two-way expectations. To discuss this, I've invited MurrayDowning, a physio student from the UEA, who is now an advert for what can happen to you if you engage with us here at the podcast. And Paula Deacon, clinical lead of #IPOPS, whom I hope requires no introduction, but if you do require one, feel free to track back to session 17 of the Physio Matters podcast, where you will find that readily available. Paula has been vocal regarding students and mentorship, and with only a small amount of cajoling, agreed to give up her valuable time once again. So without further ramblings from me, let's crack on. Welcome, Matt MurrayDowning. Well to the Physio Natters. Thank you for coming on, and well done for reaching out to us. Braver than most, I would suggest.
Thanks.
Just like some form of weird blind date, who are you and where do you come from?
Okay, so I'm a BSc physiotherapy student at the University of East Anglia, and I'm originally from Colchester, but yeah, studying in Norwich.
Brilliant. Welcome, Paula Deacon. Not new to our brand of discussion, but you don't have to put up with Mr. Chew in your proximity this time. Is that an improvement, do you think?
Oh, I don't know. He's a lovely chap, isn't he? So, no, it's nice to have you hosting, and thank you for asking.
Oh, that's all right. I suppose you employed Chewy, didn't you? So it can't be that bad.
Yeah, it's a great asset to the team.
Good. Matt, you reached out to me via Twitter with some valid points and as a result winded up as part of this discussion. Describe why it was you wanted to be involved.
Okay, first I'm obviously I'm the CSP representative for my university, and also I've got quite a keen interest in improvement in the student experience in general, but I know that obviously placements are a massive part of our progression really as students, and obviously everyone really wants to perform well and give a really good impression with sort of the different teams that we work with, and I know that commonly students are really, really anxious about going on placement. There's obviously a lot of unanswered questions, and due to the length of time that we're often on placement, it's obviously really difficult to gauge from some of the teams what they want to see from the students.
Yeah, that's good stuff. Okay. And Paula, you've inexplicably agreed to be part of our process again for a second time. Explain what urged you to say yes. A momentary lapse of faculties, maybe?
No, I'm delighted to have been asked. I'm very passionate about physiotherapy and the clinical experience that our students get whilst on placement. Over the years, I've listened to their feedback, heard how different placements differ, and also heard of their frustrations and concerns. I'm sure Matt will be asking questions that many of his fellow students wish that they could also ask. So I would just wanted to share my views on student education from a clinical educator's perspective. So I'm delighted that you asked me.
Brilliant. That's really good. I think hopefully we can answer some of those questions, really.
Yeah.
Great. Well, thank you for both coming on to what is really a pilot episode of this format of our podcast. So I'll hand it over to Matt to start with his question. So away you go, Matt.
Lovely. Thank you very much. Thanks, Paula. So first I want to start. Is there any areas sort of prior to day one of placement that students don't expect or are commonly underprepared for in your experience?
Yeah, I mean, over the years I've asked a similar question to the students when they've sort of after they've been on placement, certainly in our local community hospitals, and the general consensus is they're generally surprised at how difficult it is to communicate with real patients. They've practiced at university with their colleagues, they might have practiced at home with their family, but you start on a placement, you've got your crib sheet ready, you've got your test practice for the said joint, but you haven't really prepared for people, especially if they're in pain, so they don't always answer the way the textbooks or maybe your colleagues have answered in the university setting. So that's always been quite a challenge for students. especially if some patients are quite distressed. And I think, again, especially when maybe they've not had much life experience, students, they come on placements, maybe they're 19, 20 years of age, and that's the first time they've ever experienced that. So it can be quite difficult and challenging. So that's the biggest challenge, I think.
Yeah, fantastic. On the flip side of that question, would you say there's anything that surprises the MDTs or the team itself about the students, or?
Certainly from our perspective, when they come to us, I think it's how much pressure they put on themselves, of how much they think you want them to know before they come to you. That always surprises me, that they're expected to do more than I think clinical educators expect them to do. And certainly second year students, as they come out in the Midlands, they only come out first time in second year placements, where they've had just a year of completely new terminology, completely new environment that they've never experienced before. So I think they put a lot on themselves that perhaps is unnecessary.
Yes.
Because clinical educators are absolutely sure that they're not expecting that level. So, yeah, high expectations, I think, and it takes them a bit of time to settle down that, I'm not expected to know that. And you're like, no, you're not.
Yeah.
You can't know it. So, I'd just say that's, I think, from our perspective, the biggest thing we see. But from a student's perspective, they just feel underprepared for the communication side with people who are in pain. But they can't really prepare for it, because you learn the skills of empathy and compassion while you're on placement. So I don't think at university, in that simulated setting, that you can learn that. So that's the brilliance of placement.
Brilliant. I think that's great advice. And another thing I know that students are really anxious of is, obviously, we're really keen to have a good first impression with the team. And obviously it's really important in the context of what might be a relatively short placement, obviously to leave a good taste in the mouth, so to speak, with the professionals. What advice would you give sort of in that nerve-wracking and quite intimidating time for the students, but as well for the sort of clinical educators and the rest of the team?
Yeah, I think the most important thing is communication between placement and students, hopefully before the placement commences, if possible for either the student or the placement to communicate sometimes by the universities, or even, just general contact themselves. Certainly IPOP sends out to students sort of an electronic induction pack explaining the team setup, explaining the local community, sort of what patients they might be seeing. They will have a template ready. So I think as soon as you know what you're expected to do, it sort of reduces your anxiety. So I would say to all educators out there that, embrace your students and just give them the plan, because you should have a plan. If we're taking on students, organisations should give staff time to educate the students, so they should have time. They shouldn't be head down and just in the whirlwind of work. So that plan should be set up. We have to do it 6 weeks before because of our booking system, and that should, ideally send out to students to have that communication and tell them, explain who the names are in the team, so they're not surprised when they come in, because you're completely out of your comfort zone in an environment you're not used to. So I think more so what the educators can do for the student is more appropriate than what the students can do, because it's an environment you're not aware of. So it's our job is to reduce that anxiety by preparing you the best we can. And that's working with the universities as well, of just sending out stuff to prepare you.
Would you advocate a pre-visit, Paula?
Yeah, brilliant if you can. Sometimes the timescale, I think, is a bit tight, isn't it, between one placement and another. Absolutely. The more you can desensitise yourself to the anxieties of starting a new placement, the better. Yeah, and, I think in acute hospitals that are busy, it might be a bit more tricky, but it can be done. Just visit the department. That's what I'd encourage. Communication.
I think I found my students, when they visited prior, then don't have that sort of deer in the headlights look when they turn up on their first day. They've seen the room before, they've seen your face before. Exactly, yeah, and it just, I don't think it matters whether you're a student or a new member of staff going into any new environment. You're out of your comfort zone, and, it's a daunting experience, especially as you feel intimidated because you don't feel you know what you're doing anyway. So
it's just.
Yeah, I mean, I think that's really important. I know a lot of my sort of fellow students' emails, obviously the way that we generally communicate with the team. You're saying a lot of placement visits are obviously mentioned, but I think a lot of people feel quite intimidated about sort of encroaching on what is obviously a very busy service, and obviously being able to turn up and meet everyone and feel like you're obviously quite time consuming. But obviously it is a great opportunity if you can obviously turn up and meet everyone before that day one.
Yeah, definitely. Maybe find out when their staff meetings are, or their lunchtime break, so you're not you're not encroaching, so people aren't just whizzing around going, it's a bit stressful. And introducing yourself. But if you know your names of your clinical educator and you can make that connection, they should. And you can ask them, can you please tell me when would be a good time to come in and meet the team? I mean, that would be fantastic. Yeah, brilliant.
Stalk them on Twitter a little bit, maybe.
Yeah, definitely.
Definitely. Oh, good answer.
Fantastic. Another question I was wondering about, Paula, was obviously when we go on placement, we're obviously keen to get on with our work and try and leave a really good impression about the work we can do. How do you find the balance between sort of getting your head down and working, but at the same time interacting with the rest of the team, and sort of finding that you're not wavering to either side and not talking to your team enough or talking to the team too much?
Yeah, I mean, it is a fine balance, but I mean, I'm not a fan of head down working. I think you can do head down working when you're at university or at home. I think it's vital that you absolutely, you're a sponge on placement and you take every opportunity to talk to anybody and everybody, whether that be the admin, any of the support staff, as well as your fellow colleagues. For me, it's about motivation. It's about being passionate about, it's hard enough to get into physio school. So once you're in, it's a privileged position, and it's out on placement is where you would apply everything you're learning in uni, which is a bit of a sterile environment. So head down is not the best thing. You've got to do your work and make sure, obviously, the notes are in order and you're clinically reading your patients. But outside of that, get your head out of the books. I'm never happy when I see students' heads in the books, because you can read that at home. You're here to embrace the reality of what it's like on the clinical floor. So just be a sponge. Just talk to everybody and anybody, and just ask questions. Be inquisitive. Embrace it, yeah.
Yeah, definitely.
That's what I'd say, really.
I think that's a really good point, actually, Paula. I hadn't thought of that before, but if you've got a question and you feel that you want to go and look it up in a textbook, but you're on placement, why not ask the educator? Because then you would get context added to potentially the correct answer.
Absolutely. Yeah, absolutely. And hopefully, as time's going on, and I think social media is really breaking down barriers between students and educators. Well, here we are, Matt. This is really, which is fantastic. It's just brilliant. It's just breaking down them barriers, and you feel as a student you can ask, well, why? In what context then? Because I've learnt this at uni. This is what we have. Well, I've learnt that at uni, but actually in this context, it's not applicable. And why is that? And you can't learn that out of a textbook. So that's where you need to absorb it, and then that's reflection, and that's more valid than any head down reading.
Another thing I've heard, Paul, is we've heard a lot of experiences from other students that involve a lot of inconsistency from their educators. For example, like a very, very positive halfway review, perhaps when the team are quite new, followed by a final assessment that's perhaps not so positive. Obviously, at which point the feedback that they've been provided on that final review is obviously a bit too late to be rectified. What do you think the profession can do to reduce the inconsistency for students, or what can students do to prevent that?
Yeah, I mean, I'm very disappointed to hear this, Matt, that this occurs. I mean, educators must be consistent throughout the placement and communicate with both the students and the universities. I know universities are brilliant. They have visiting, certainly locally around the Midlands. I'm sure they do in Norwich.
Yeah.
You have a visiting tutor, and the communication is there. So why this happens, I don't know. And I think what needs to happen is to hear at the end of a placement that you've not performed as they wanted to, whether that's because their expectations were raised and they were just trying to push the students, so they didn't. You were still safe and you were still within your guides of what competency you should be at, but they just wanted a bit more of you. I don't know the scenario, but as an educator, we have to stand consistently, and again, that's something the universities locally they do monitor that with the scorings. But it's sad to hear that that's happening, and that's really challenging for students to come away thinking, well, I thought I was doing brilliantly.
Yeah.
And then if that confidence, because it will affect your confidence. So
yeah, of course.
It's just having that relationship, that bond with your educator, and that might not just be a named educator. It might be, in our team, in IPOP, sort of the student is everybody's responsibility. Yeah. So it's everyone. There'll be a named lead clinician, but it's just getting feedback from everybody, because your outcome of your placement's not just about what you do with your patient. It's how you interact with the team. It's how you discuss things with even the admin staff, your time management. I mean, it's multifactorial, isn't it? And part of that, as an educator, is to facilitate that learning, because you're in an environment you know nothing about. So, and the NHS is very complex, really, in the systems it runs. So a lot of it has to go back on the educator rather than it's the student's issue. Do you know what I mean?
Of course, yeah.
We have to take responsibility for students when they come in, and if they're not performing for whatever reason, it's a conversation between themselves and get the visiting educator, the visiting tutor in, because generally things are mulled over. Things are found of why, and that can sometimes be personal issues that are outside people's control. Really. So, I think it's just down to communication, isn't it? Always.
Yeah, of course. I mean, that's the biggest thing I've heard from generally from other students. Obviously, that each educator is obviously looking for a slightly different thing and have a different idea in their head of what they want to see from their students. I think it is, as well as being adaptive and understanding from each placement, as say, communicating with everyone just to find out what they really want to see from you and delivering that.
Yeah, and I think that's the challenge universities have. I mean, we've got students, year 2 students with us at the moment, and the what they found they've been taught in year 1, they've had to almost unteach themselves on placement, because they're saying that it doesn't seem to be related to what you're doing in IPOPs, because we don't use the massage, we don't use the electrotherapy, yet they're still learning it.
Yeah.
But I think the difficulty is that some places are using that. So, that's for the universities to try and get this streamlined, standardised placements out there that everyone can still, can flourish then, because otherwise it's multi-skilled.
That's a problem, isn't it? I think if you've got some people who, as you say, Paula, they maybe are working at a different level to another department. The student might have gone on 2 musculoskeletal placements and have been required to do full assessments and full treatments in one, and then not required to do that in another one. Do you think there's any mileage in something like a national type framework? You remember we had KSF for our job descriptions almost where a few years back. Do you think something like that would be useful for student guidance, or do you think that would be too complex because of the nuance of each placement?
No, I think certainly, I think there should be a framework. There should be an MSK type framework. There should be a paediatric one, a neuro one. I think there just needs to be consistency, because it's so confusing for the students. It's so confusing for the universities to know the level of education. I mean, our students said today that, if they go on another placement, they almost feel de-skilled now. And I'm like, wow, that's quite a statement. You feel de-skilled because you're applying evidence. And he said, I think some placements would deem me as being de-skilled because I don't do ultrasound, I won't be doing massage. And that's what you're dealing with in the real world. And I think that's really challenging for the universities. And wow, that's really challenging for students. So, we used to have workbooks. You'd have to do your cryotherapy. You'd have to demonstrate things. But I guess that's up to the university to decide. If that's the case, then what centres do students have to go to be able to tick their boxes? If
we were to have that written, who do you think should lead? Do you think universities should lead the criteria?
No, I think it has to be a combination between academic and clinical leaders. There's no, because a lot of them, the lecturers, if they're not in constant contact with the clinical research, then it's outdated stuff. So I think it's a collaborative approach. That's what's needed.
As you said, communicate more, really, don't we? I think there's not enough communication between educators and universities to see what is actually going on.
And I think the students sometimes feel a little bit in the middle of that, and that's causing frustrations.
Do you think something like that would be helpful?
Yeah, I think it definitely would be. As you say, we hear a lot from both sides of the story. Obviously, we get information from our university. For instance, we get a placement handbook. I know a lot of other universities that I speak to do a very similar thing, which often states where we're expected to be for a certain placement and what is expected of us as the weeks go on. But as you say, when you do generally get on placement and you talk to your clinical educators and the team, obviously you form your own ideas of where that might vary, where they may expect more or less in certain areas. And as you say, I think it would be really, really helpful to have a more generalised overview that everyone could see and agree
to bring
on.
up at your CFP meetings, Matt.
Yeah.
Well,
definitely.
Paula and I leave that to you, I think.
Yeah.
That's brilliant. No, that's fantastic. Another thing I'd wanted to ask Paul, really, just to sort of end on, was I know myself, I've only got a year and a bit to go now, but towards the end of our degrees, when we're considering obviously being employable, how is it best to go about our CPD? Because obviously many ex-students and clinicians that I've spoken to have talked about massage courses, taping courses. Are these needed?
It's so difficult because there's so much practice and variation out there. It's just so difficult. What I would say, as a leader of quite a large now department,
and quite well respected, Paula.
Thank you, Jack. Thank you. If you're looking for new skills, you've just spent 3 years learning new skills.
Yeah.
You need time to consolidate them. So, as an employer, it wouldn't matter what was on a CV. As a band 5, I personally actually wouldn't even want to see sort of post-grad courses, because it just means you're searching for something else and there's been no consolidation, there's been no depth of knowledge, because you need to spend at least another year minimum consolidating everything you've learnt, applying it, clinically reasoning it, and you really save your money and don't waste your time going on things, because you'll find you don't. I suppose it depends what arena you want to work in. It might be different if you want to go on a sports, go and work with sports. But, in the NHS, certainly where majority of physios do get employed, it's really not necessary. You're just trying to find something you generally don't need. And if you do, you can do it on the job, and you can, the taping, well, if you don't want something to move, you can learn how to do that. It's more applicable when you're in the role. But certainly, for new grads, absolutely, take pride that you've got a passport into this great profession, and that you just need time to consolidate, and you don't need any more skills. You've just been given a heap loads of them, and you don't know what to do with them, and now you just want to add some more, and it gets a bit confusing and murkies the water. So I'd strongly recommend just get comfortable in your skin, get comfortable where you're at your graduation, and find a job that that will help you and support you and facilitate learning. That would be my recommendation.
That's a really interesting comment, actually. As you say, we often go to some of the CSP meetings, and you sort of chat to other universities, and you almost sense a bit of almost competition, really. What's the university done course-wise? Have you done massage? Have you done taping? And it's interesting your comments about that, really, because the general impression that I feel that everyone seems to feel is that the more courses you have, the more you stand out. So it's really interesting that you say that.
All I can say, Matt, though, is that's IPOPs. It wouldn't matter. We've if you've listened to the podcast, it's more about the values. Everyone comes out with the same. It wouldn't matter whether you got a third or a first class. It's about you as a person and you as a passionate, caring, compassionate individual. That's what we want to employ. And along that journey then is you're in a department that then facilitates you applying the knowledge you've got to be in this great profession, and just keep going with that. So it's not necessary. Some people might argue it is, and that they want people with certain X, Y, and Z skills. I'd hope in the NHS that is diminishing because it's not cost effective or applicable. So, we've just got to use our resources more efficiently. So it wouldn't matter. It wouldn't matter. And I'm hoping, employers out there are hearing that maybe, I don't know what we're expecting people to come out with. You're on a journey, and you start on a pay scale. You paid a band 6 when you come out, you're paid at a band 5, so that's a journey you've got to go on. And I think within the profession, that's another thing we need to ideally look at is and people try and do too much too fast too soon and have too much autonomy when actually you're not paid for that and you're not competent to have it. So that's another discussion for competencies, and I won't go into that.
I think just to throw my idea out there a little bit. I mean, Matt, you're now willingly or unwillingly, a little bit of an advocate for this. But I think, as Paula said, with the new growth of social media, I think that actually just engaging via something like Twitter or Facebook, being involved in something like the Physio Talk type hashtag, involved in those things and have people have an awareness of you, that is far more powerful, that you've been engaging and you, as Paula said, have a desire to engage with the profession than, let's say, a taping course or a massage course.
Yeah, that's brilliant, yeah.
Spend your time doing that.
Very interesting you'd say that, actually. I talk to a lot of people, and it's our university, and I know a few others, are very, very keen on obviously promoting social media. So it's a fantastic way to reach out to people. I know a lot of people are really nervous, but I think it's just, if you're willing to put yourself out there a little bit, in the right way, I think people will respond really well, and it creates a lot of opportunities, which is nice.
Yeah.
You're not that scary.
I mean, everyone on, is just so sharing. They're so, the knowledge that is shared is phenomenal. I mean, the people that I've met and now work with through social media is just phenomenal, and our local community, the team that supports them is just, through social media, just phenomenal. And I think that speaks volumes, really. And times are changing, and it's not the historic way we used to do things. So, and that's just starting. People just need to change how they think about what skills they need, and actually less really is more. And it just depends where you're going to work, and there are places that are still doing stuff. They'd probably want you to have the skills of that, but doesn't mean to say maybe it's not the right place to go if you haven't got them. It's not because you're not good enough. Maybe they're not good enough.
I think Matt's hastily writing down your email address for us.
Yeah, come on over. You're more than welcome.
We've got that recorded, Matt. But unfortunately, I'm going to have to bring us to a close on this fascinating chat. We can't carry on all night. Some things I think would probably warrant some further discussion. I think, Matt, I hope you found it helpful. I've certainly enjoyed it.
Thank you very much.
Good. And thank you very much, Paula, for giving up your precious time this evening.
Oh, no, it's been a pleasure, as always.
I'm sure Physio Matters and Physio Natters will leave you alone for a little while. Let you recoup for another year, and then we'll bring you back again.
Anytime, no worries.
Okay. Well, thank you very much once again to both of you.
All right, guys. Bye. Bye.
Well, there we are. I hope you've enjoyed listening to our discussion, and once again, thank you to my two guests, Paula and Matt. There are some cracking take-home points for students and educators in there from Matt and Paula, and I hope communication will improve as a result. It can be difficult for students entering a new environment, and while it is imperative that educators afford time to these students, remain consistent and help train the next generation, I can't help but feel the widespread pressures in NHS are inhibitory towards this. I agree there needs to be more communication between educational institutions and clinicians, and that consistency, maybe through a national framework, would be useful. But currently I see no way that this is going to change unless there is a widespread shift in culture within physiotherapy that actually allows consistency to be achieved within departments, never mind across counties. A utopian therapy world where we can all spend maximum time with students, meet them prior to their placement, and adhere to a consistency framework seems a long way in the future in my eyes. Maybe we can all start to change this slowly, and conversations like this one will hopefully speed up the process. We don't bite, so feel free to interact with us as Matt did. You can find us all on Twitter. Paula at PaulaWoods5, Matt at PhysioStudentUK, and myself at PhysioJack. If your feedback doesn't fit into 140 characters, then please email us at physiomatters@choosehealth.co.uk. Obviously, I should plug the main Physio Matters podcast and all its associated projects and team members. Find us at TPM Podcast or www.choosehealth.co.uk. I'll see you all next time for more Physio Natters.